Over the years, I've had people to ask me, say, well, Dr. Rawlings, why should I continue to worry about AIDS? I mean, we've solved this problem. It was on the cover of major magazines that AIDS is over and resolved. But the problem is that more people still get infected. More people still have a need. More people are still dying of this disease. Yes, more are living with this disease. What that also means is it puts a strain on the available resources that we have to take care of it. If you look around, there are so many needs in our society, from education to housing to employment. We have competing priorities and competing demands on things that are just as significant. So why HIV? Well, one of the things I would say is that in many ways, HIV is almost emblematic of some of these other problems, because many of the people that we see who are HIV positive also have issues of housing and employment and other components that contribute to making this very difficult. But the other reason that I tell people about this is because this is an infectious disease. And by being able to treat one person, I substantially decrease the likelihood of a new person becoming infected. That's relatively not unique, but is very uncommon, because most of what we deal with in medicine is individually driven. This is a case where treatment and prevention intersect in a way that is very profound, very direct, and very important. So that while we talk about this and say, well, why should I treat this particular issue? The answer is you prioritize a lot of things in life. But if you had to ask the question of not only something that affects someone who I care about or who I know, or a coworker who I can look at and say, I'm impacting something that this person has, consider the idea of being able to impact the possibility that a new person may never get it. And by helping programs like us to be able to provide the care and support and treatment that we do, you not only provide it for that particular individual who is sitting on an exam table or across a desk from me, but you also help that person who may never know because they didn't get it. They aren't becoming infected. It is that combination that makes it, I think, rather compelling.